What is the right exercise dosage for osteoporosis bone health? Imagine strengthening your bones with the right kind of movement. For people with osteoporosis, exercise is a powerful tool to support bone health, but knowing how much and what type is key. The goal is to do activities that help slow bone loss, build strength, and reduce the chance of falls. Combining different exercises is the best approach. Weight-bearing aerobic exercises are essential because they put stress on your bones, encouraging growth. Think of walking, climbing stairs, dancing, or doing low-impact aerobics. Aim for at least 3 days a week, with each session lasting about 20 to 30 minutes. The activity should be moderate enough that you can talk but not sing. This adds up to roughly 150 minutes of activity weekly. Activities like swimming or cycling are great for overall health but don't load the bones in the same way, so they are less effective for bone strengthening. Resistance training is equally important because it helps build muscle and supports bone density. You should do resistance exercises 2 to 3 times each week. Each session should include 2 to 3 sets of 5 to 12 repetitions for major muscle groups like the hips, back, and legs. Use weights, resistance bands, or your own body weight. The effort should be challenging but safe, around 75 to 85% of your maximum lift. Proper technique is vital to prevent injury, especially if you have very low bone density or a history of fractures. Balance exercises are crucial for reducing falls. Activities like Tai Chi, standing on one leg, or heel-to-toe walking can improve your stability. These should be done at least once a week, ideally up to 3 times, for about 15 minutes each time. Combining balance work with other exercises enhances overall safety and helps prevent fractures. Impact exercises, such as jumping or jumping rope, can stimulate bone growth when done carefully. They involve short, high-force movements. Start slowly and aim for 10 to 50 impacts per session, 2 to 3 times weekly. If you have advanced osteoporosis or previous fractures, it's important to talk to your healthcare provider before trying impact activities to ensure safety. Flexibility exercises like stretching are also helpful. They improve your range of motion and help prevent injuries but do not directly increase bone density. Incorporate stretching into your routine regularly, but remember that weight-bearing, resistance, and balance exercises are the main bone builders. The key is to tailor your exercise routine to your individual needs and abilities. Start slowly, listen to your body, and increase activity gradually. Avoid exercises that involve twisting, bending forward, or high-impact movements if they could risk fractures. Always consult a healthcare professional or physical therapist before beginning a new exercise plan, especially if you have a history of fractures or other health issues. In summary, the right exercise for osteoporosis includes weight-bearing aerobic activity 3 times a week for about 20 to 30 minutes, resistance training 2 to 3 times weekly with moderate to high effort, balance exercises 1 to 3 times weekly for at least 15 minutes, impact activities 2 to 3 times weekly with gradual progression, and regular stretching. Consistent, safe exercise can make a significant difference in maintaining bone strength and reducing fracture risk. Remember, personalized advice from your healthcare provider is always the best way to ensure your exercise plan is safe and effective for your unique situation.